All right, so today we're going to talk about acne. So I'm going to give you a little background what really acne is. So this is a normal skin picture. So this is different layers of the skin, as you could see, and there's the hair that comes down, and this is the deeper layer of the skin, and you could see on the side of the skin the face, and you can turn it around, and you can see these are the sweat glands which comes out, and we go back towards what happens here with the acne. So now, first of all, so through the hair follicle, as you can see, when the hair follicle gets blocked, there's a little bit of bacteria which will be collected under the blocked area on the follicles that will grow and cause the infection of the follicle, and then that's what it happened. So I will show you next what happened after that. Now, the previous model, this is the same similar model, but a little bit of an illustrative to see what happens after that. So we saw up to here what happening on the previous picture, that we saw that, okay, this is the regular acne. So what happens after now? When this acne, when it becomes bigger, you can see that the inflammation spreads. You can see that now there is more redness around the infected follicle, and then you can see it's going to get a little bit bigger again, and then it gets even more. It can involve lots of tissue around, and then after that we go further when your pus comes out, and this is the empty space which is left behind, and then after that it can cause this depression of that. That's what acne scar is. So what will happen now, all that area that was full of pus now is collapsed. So this collapse caused the depression, and that's the different progression. And then after that, as you could see now, the scar tissue formed underneath that, and the scar tissue caused pulling of that area. So that's why different stages of acne needs different treatment. If there's a stage 1, which is just like this, is different. Basically, at that point, we can just treat it with some benzoyl peroxide, some cleanliness, and also blue light can treat it well. When there's stages more, this is the stages probably that needs more treatment. Even probably at that stage, you need some antibiotic because the tissue around it will get involved. When it goes further down, this is the scarring phase. Now, the scarring is already beginning. This is the stage that probably lasers will work there. And then comes with the stage of the deep scarring, that when the scar tissue is formed, that's the time that maybe you need radiofrequency RF at this point to kind of equal the depression and elevation in the skin. So let me show you also how does the blue light look, and how we're going to treat that. So we could do a couple of things. We could use the blue light alone. So what we could do, the patient sits in a chair, when we bring the machine here, and then at the same we can just adjust this thing on the top of the patient, and this way the patient is going to stay for half an hour under the light, and that will cause that the blue light would need this. Before that, we could also there's another thing is called phototherapy. What we'll do, we use it with luvulonic acid. We can peel the skin first and then put the blue light on top of that, which will activate luvulonic acid, and it will even better, even stronger. So, and also what we can do, that the type of lights, we can also combine it with different light. Now this one, it's going to be a combination of the two lights, because now we have got blue and red light. Blue light for the killing of the bacteria, and the red light for healing, and that's the combination work much better. So this is one of the things that we could do with the acne, which is easy, it's non-invasive, and very effective.